a man who really needs no introduction. I am Congresswoman Val Demings. I am honored to represent you. And we have Dr. Anthony Fauci, who is joining us today. He served American public health for over 50 years and has served in Democratic and Republican presidents. He is one of the most renowned, most trusted voices and trusted experts in his field. Central Florida, while his work within the National Institute of Health and the National Institute on Allergy and Infectious Disease expands decades, we, during the last year, most recently learned to affectionately refer to him as America's doctor, as he helped us to navigate the turbulent, sad, and tragic times of the last year. Currently serving as the Chief Medical Advisor to the President of the United States, President Biden, Central Florida, I am so proud to present America's doctor, Dr. Anthony Fauci. Dr. Fauci, thank you so much for joining us today.
It's a real pleasure to be with you, Congresswoman.
And thank you. And I know the listeners and participants are anxiously waiting to hear from you. So I will start off. Dr. Fauci, as you know, when President Biden took office, he promised 100 million shots in the first 100 days. Now, we all thought that was a pretty ambitious goal. But now President Biden plans to far exceed that number. Dr. Fauci, can you give us an update on the administration's progress?
Yeah, things are going really very well with regard to the vaccines. We by the 1st of May, anyone at any category will be eligible to get vaccinated. We started off by having the phase 1A, B, and C, and 2, that people who are healthcare providers and the elderly, et cetera, et cetera. By the time we get to May 1st, everyone and anyone will be eligible. By the time we get to the end of May, there will be enough vaccine to vaccinate essentially everybody in the country. So we really need to make sure that people are ready to get vaccinated when your time comes to just get vaccinated. Right now, about 17% of the country has been doubly vaccinated and fully vaccinated, and over 20+% have at least one vaccination. We are doing extremely well with regard to the implementation of the vaccine program.
Wow, that's pretty amazing. I know that currently we have 3 vaccines that are available: Johnson & Johnson, Moderna, and Pfizer. Dr. Fauci, how does an individual decide which vaccine is right for them? Should they request a specific one? And we heard some news just today that there has been great progress made in terms of vaccinating teens. So if you could also talk a little bit about vaccinating America's children.
Sure. Well, it really does not make any difference. My advice to people is to get the vaccine that's the most readily and quickly available to you. The 3 vaccines that have been given an emergency use authorization by the FDA are the Pfizer, the Moderna, and the J&J vaccine. They're all exceptionally efficacious in preventing COVID-19 disease. So I wouldn't wait for one versus the other. The one that's available to you most conveniently, I would take it. They're all really very good. The thing you mentioned about vaccinating children, Pfizer has just come out with data showing they did a randomized placebo-controlled trial in children 12 years old to 15 years old, and they found that the vaccine was highly, highly efficacious. It was 18 infections in the placebo group and 0 infections in the vaccine group, which gives it essentially 100% efficacy. Now, that doesn't usually last forever, but I can tell you it's going to be very, very high efficacy in children. We hope by the time we get to the fall, we will be able to vaccinate all high school children. and that by the time we get to the end of the year, the beginning of 2022, we'll be able to vaccinate children of virtually any age.
Wow, thank you so much for that. You know, Dr. Fauci, there are probably few issues that has caused more controversy. Well, none should have during this time, but a few issues that's caused more controversy than the wearing of face masks. Now, you know, we are encouraging everyone to get vaccinated. So as we move forward, you know, looking back 1 year later, what is the most important thing people can do right now in this stage in the game to protect themselves, their families, their coworkers, and others?
Well, apart from getting vaccinated, which is absolutely an important and critical element of controlling this virus, there are several common sense public health measures that we've been talking about constantly and publicly. And that is universal wearing of masks, avoiding congregate settings, particularly indoor, keeping physical distance where you can, washing your hands frequently. If we did those simple things, we would be able to prevent any further surges of outbreaks. Because right now, you know, although we're doing quite well, the number of cases per day has plateaued at around 60,000 and starting to creep up. That's a very worrisome sign. And that's the reason why we're concerned when we hear that certain states and certain cities are pulling back on the mandates for masks and pulling back on the recommendation for public health measures. It is too premature to declare victory right now. We're on our way. We're getting there. Every day that goes by, at least 3 million additional people get vaccinated. And the more people that get vaccinated, the closer and closer you are to a very good control of the outbreak. So rather than prematurely declaring victory and pulling back on all preventive measures, hang in there a bit longer. We're going to be able to pull back on that soon, but not quite yet.
So, Dr. Fauci, even those of us who have been vaccinated, we still need to practice the CDC guidelines today, just as we did a year ago.
Yeah, let me explain the reason for that. Is that right now, vaccinated people are highly protected against getting symptomatic infection. But we don't know how well protected they are against getting infected without symptoms. So they may actually feel well, be infected, have the virus in their nasopharynx, and inadvertently spread it to someone else. And that's the reason why we're telling people who are vaccinated, when you go out in the community, continue to wear your mask. Having said that, more and more data are accumulating that when you do get vaccinated, the protection, even against asymptomatic infection, is very good. And even if you do get infected, the level of virus in your nasopharynx is very likely much lower, so that it would be very, very unlikely that you're going to transmit it. But until we know for sure, better be safe than sorry. And that's the reason why we say you could still wear the mask. However, I want to clarify, if you're vaccinated and you're with another vaccinated person in the setting of the home, you don't have to wear a mask, and you could have physical proximity and physical contact. And even if there's someone like a child or someone who's in the family that's not vaccinated, even then, if the children or the other people in the house don't have an underlying illness that would make them susceptible to a severe outcome, you don't have to wear a mask. You can hug them, you can kiss them, you could do all that.
Thank you so much for that, Dr. Fauci, because as you know, we're all so very anxious, but we want to be good stewards in terms of doing our part to keep each other safe. We now have a question from one of our constituents, Carmen Torres. Carmen, you're muted.
Can you hear me now?
Yes, I can.
Perfect. Thank you, Congresswoman Demings, for putting together this webinar. And thank you, Dr. Fauci, for taking my question. This is all great news that I've heard so far. But as you may know, Florida has a large population of undocumented residents, over 775,000 by some estimates. Central Florida also has a large homeless community. What is being done to reach out to these vulnerable communities, and how can we make it easier for them to access the vaccine?
Carmen, that's a very good question. And part of President Biden's equity program, we are making every effort to get an equitable distribution of vaccines to all people who would benefit from them, which means everyone. And let me tell you some of the things that are being done. Community vaccine centers are being put up in various regions, various cities, various states, even rural areas, to make it convenient for people to get vaccinated. Federally qualified community centers are going to be giving vaccines. Multiple pharmacies are going to be stocked with vaccines so that they will be available. And for poorly accessible groups, like some of the ones you mentioned, Carmen, we're going to use mobile units to get out to access them, to bring the vaccine to them. So those are four major issues that we're addressing in order to get vaccines to people who need them. And undocumented should not worry about getting vaccinated. There is not going to be any issue with regard to getting one in trouble by getting vaccinated. That has been promised by the Department of Homeland Security.
Dr. Fauci, thank you so much. You know, Florida has significant numbers of the COVID variants. Could you talk a bit about the different variants and why it's so important to keep track and make necessary adjustments within our state?
Well, a variant is a change in the virus that's caused by mutations. Sometimes it doesn't have any consequence, but sometimes it does. For example, there's a variant which is referred to as the UK variant because it was first noted in the UK. It's given a number, and the number is 117. That variant is becoming dominant in the United States. We know that it spreads about 50 or maybe even more % better than the standard virus. So that's one of the reasons that we might be seeing a beginning of an uptick in cases. The vaccines handle that variant very well. There's another variant called the South African variant, the 351, that it diminishes somewhat the ability of the antibodies that are induced by the vaccine to neutralize it. So that's one we have to keep our eye out on. What we're doing is we're doing a lot of genomic sequence surveillance to keep track of these variants to determine if we have to make any modification in our vaccine program to address them. So we're all over it. We're very well aware of it, and we're on top of it.
Dr. Fauci, can you talk for just a moment about the development of therapeutics to address COVID-19?
Yes. So therapeutics, in some respects, have lagged a bit behind vaccine. We've had a spectacularly successful vaccine program. We have treatments for people with advanced disease to prevent them from going on to get more severe disease. That has worked well. Like, for example, the common drug dexamethasone is given to people who are hospitalized and either require ventilation mechanically or need high flow oxygen. There are a number of interventions that need to be given early to prevent people from coming to the hospital. Monoclonal antibodies are one. Hyperimmune globulin, we're trying to determine if that works. Convalescent plasma didn't work as well as we would have thought, but you need to give it very early. But the real effort we're putting in now is the development of targeted antiviral drugs that are directed specifically against the virus that you could give early in the course of infection to prevent someone from the need of having to be hospitalized. We're making a very major investment in resources to develop that program of targeted antiviral therapy.
Dr. Fauci, we're going to hear from another constituent, Faye Norris.
Good afternoon, everyone, and thank you, Congresswoman Demings and Dr. Fauci, for this opportunity to ask my question. So you mentioned the variants earlier, and regarding those variants of the COVID-19, and Florida has seen some high numbers of these variants as well. Will we need to get any additional vaccines or booster shots because of these variants? And if so, when do you think this would happen? And would even my grandchildren need to get them as well?
So the answer is we do not know for sure, Faye, whether or not we would need to get boosted. We are following right now the level of immune parameters, antibodies, T cell responses, to see how durable those responses are. It's entirely conceivable if the immune protection diminishes that we would have to boost people against the original virus or possibly against one of the variants. This is all work in progress, but we are prepared to do both. And in answer to your question, when, that likely will be a year after you originally get vaccinated, but we don't know that for sure because we need to follow the level of the immune response. And hopefully that we will soon have enough information to be able to say that you can safely and effectively vaccinate children.
You know, millions of Americans contracted COVID-19, but have suffered over an extended period of time, sometimes called long haulers. Could you tell us more about them, why this happens, and more about health research that is being done to address this issue?
Yes, the syndrome that you're referring to is sometimes called long haulers, or it's called a post-acute COVID syndrome, which means that individuals who get COVID-19, the disease, they could have mild disease, moderate disease, they could be hospitalized. We're noting that a variable percentage, and we don't know exactly what number that is, Congresswoman, but it's somewhere, could be 20, 25% or more, that for several months following their virological recovery, in other words, they've cleared the virus from the body, so they should start feeling really well. They have a lingering, sometimes as long as several months, of very difficult to explain symptomatology that doesn't really have an absolute explanation. It's profound fatigue, muscle aches, temperature dysregulation, sleep disorder, fast heartbeat, which is called tachycardia, and a thing called brain fog, which means they have a real difficulty in focusing or concentrating. Again, we're making a major investment, $1.15 billion, to do research on this syndrome in order to determine its extent, what its possible cause is, what the mechanisms of the disease are. And once we learn that, is there anything we could do with regard to treatment of this disorder?
Thank you so much, Dr. Fauci. We're going to now take a question from the director of Florida Department of Health right here in Orange County, Dr. Pino.
Can you hear me now?
I can.
Thank you.
I can see you.
Oh, you can see me? Let me open the camera. So, Dr. Fauci, a question for you, sir. And before I ask the question, let me thank you for all the work that you have done on HIV. I know a lot of attention has been brought into the COVID-19, but if we are closer to a functional cure, it's in part because of the work of your lab at the National Institute of Health. So thank you. But sir, is there a rationale for guidance from the federal government about limiting appointments to the shot's availability for 2 doses rather than just expand to 1 dose until we vaccinate a higher percentage of the population?
You know, that would be an issue if we didn't have enough doses to distribute and if this were like back in January. But we are so close now to having enough vaccine for everyone and everybody that the risk of only a single dose, particularly when there are variants that are circulating, and we know there are variants in Florida for sure, that when you give a single dose, even though the dose is good protection against the wild type virus, its durability of protection and whether it's high enough to combat the variants is particularly unclear right now. So it would be very risky to give people just a single dose rather than getting a very, very high level of immunity with the 2 doses.
Dr. Pino, thank you. And Dr. Fauci, thank you so much. You know, one of the questions that we frequently get from constituents is about, you know, they want to get the vaccine because they certainly want to protect themselves and their families. They're concerned about side effects. Dr. Fauci, could you just talk a little bit about the side effects and how concerned or not concerned should we be about those?
Yeah, these vaccines thus far, and now they've been given to tens and tens and tens of millions of people, are really quite safe. I mean, when you talk about side effects, you talk about reactogenicity. So I got vaccinated with the Moderna vaccine. The first one, which is a prime, I felt an ache in my arm for about 24 hours. First, only when I pressed on it, but then I could even feel it. It went away in 24 hours. 28 days later, when I got the boost, I also felt a bit of an ache in the arm. But then for about 24 hours, I felt fatigued, a little achy. I felt actually a little chilly. I know because I was in my house and my wife just had a shirt on and I had 2 sweaters on. And I said, boy, it's cold in here. And she said, no, I think it's the vaccine response. That wasn't serious. It lasted for 24 hours and then it was gone. But with regard to serious side effects, it has been extremely rare. In fact, there have been, to my knowledge, no really, really serious side effects. So it's quite a safe vaccine.
Thank you so much, Dr. Fauci. I know our constituents are listening and anxious to go and stand in those lines to be vaccinated. As we come to the end of our time, and I just thank you so much for just taking the time to spend, you know, a few minutes with us here in Central Florida. It means a lot to me. It means a lot to the people that I represent. Dr. Fauci, we've made so much progress in such a short period of time. As you well know, you've been a major part of the progress that we've made. But as we look down the road, where do you anticipate we will be 6 months from now? Or what will we look like a year from now as it pertains to COVID-19? Will it be before us or will it be in the rearview mirror?
You know, I believe that if we do the things that we're talking about now, you and I, getting people vaccinated so that the overwhelming majority of the population is vaccinated, in the meantime, making sure we implement public health measures, I believe by the time we get to the end of this year, we'll be looking at this in the rearview mirror. It's not going to be gone 100% completely, but it will be much, much closer to what you and I used to know as normal. Maybe not 100% there, but very close to it.
Well, Dr. Fauci, thank you so much for your service, your decades of service. Thank you for accepting the role, even though you didn't ask for it necessarily, of America's doctor. You have been just so invaluable to our progress in dealing with COVID-19 and helping us to have the kind of response that the American people really deserve. And so thank you so very much for spending time with us today. I want you to take care and stay safe as well.
Thank you very much, Congresswoman. And thank you for allowing me to be with you. It's been my pleasure.
Thank you. We do have a second portion of our town hall today. I ask you to please continue to stay with us. We're going to get to more of your questions. We have a panel of experts from Dr. Pino is also going to be a part of that panel, but we have representatives from FEMA and representatives from 2 entities that are helping to provide vaccines to right here in Central Florida. And that's Winn-Dixie and Walmart representatives are with us as well. So we're just going to take a few seconds here to regroup, and we're going to start the second half of our town hall.
Hi, everybody. I'm Daniel with Congresswoman Val Demings' staff. I'll be joining the Congresswoman for the second half. I would ask all of our panelists for the second half to now turn on their cameras and to give brief introductions for themselves. And we will start with FEMA.
Good afternoon, and thank you, Congresswoman, for inviting me to this part of your teletown hall. I am Gracia Check. I am the Regional Administrator of FEMA Region 4 based in Atlanta, which covers the 8 southeastern states.
Perfect. And now we will go to Dr. Pino, please. Oh, and you're muted, sir.
Yeah, my name is Dr. Val Demings. I'm the health officer for our Orange County, which is at the heart of Central Florida, and placing a regional role as we also help our neighbors into this pandemic.
Great. And Joe?
Hi, everyone. Thanks for having me here today. I'm Joe Caldwell. I'm Director of Corporate Communications and Government Relations for Southeastern Grocers, which is the parent company of Winn-Dixie and Harvey Supermarkets and Fresh Moss here in Florida.
Great. And last but not least, Lisa.
Thanks for inviting us to participate in this event, Congresswoman. We appreciate the opportunity. We also really appreciate your leadership during the pandemic, especially around vaccine equity. It has really been noticeable, and we're very proud to be providing vaccines in the Orlando area. My name's Lisa Smith. I'm a pharmacist by education. I sit on our clinical team and have been helping with our COVID response and most recently our vaccine rollout. With 90% of the US living within 10 miles of a Walmart, we feel like we're really uniquely situated to serve Americans where they are, especially in medically underserved areas. Here in the Congresswoman's district, we've been operating 8 vaccine sites, and we're proud to be opening 5 more this Saturday. So we look forward to answering any questions you might have, and thanks again for the opportunity.
Great. And Congresswoman, it's all yours.
Thank you so much, Daniel. And as you can see, we have an outstanding panel who is here today to answer your questions. We have several questions that have been submitted by persons who are on. We will certainly get to those. I would like to begin the questioning with Administrator Check. Thank you so much for being with us, and thank you so much for the time we spent together a few weeks ago. You know, FEMA always plays a significant role, a major role when we have an emergency situation. Here in Central Florida, we are certainly used to natural disasters, but now you're really playing a new role, if you will, in terms of responding to COVID-19. Could you just talk a little bit as the Region 4 Administrator about what you're doing on the ground and how you're participating in this process to getting us back to normal?
Sure. And again, thank you for the invitation. And it's my pleasure to be with everyone virtually today. FEMA's mission, as you stated, is helping people before, during, and after disasters. And our guiding principles help us achieve that mission. And I will tell you, it has been quite a mission this past year, and one of the most rewarding missions that I've ever done in my over 30 years of emergency management. FEMA's committed to the equitable distribution of the vaccine, and our top priority is to ensure everyone who wants to get a vaccine gets a vaccine. And we're supporting Florida's vaccination efforts by providing expedited financial assistance to those that are opening vaccination sites, and also with equipment and supplies and personnel. We partnered with state and local officials in Florida to establish 4 community vaccination centers, which opened on March 3rd, Orlando being one of them, and the other 3 are in Jacksonville, Tampa, and Miami-Dade. And with those sites, well over 300,000 vaccinations have been administered, with over 90,000 alone at the Orlando site. In these centers, they're state managed, federally supported sites, and they're primarily staffed by the Department of Defense personnel. And they were chosen by the state of Florida, FEMA, and the White House because they can serve some of the most diverse and socially vulnerable communities in the state. And to increase vaccine equity and accessibility, we also partnered with the state on smaller satellite offices that are in the Orlando area. and so that really gets out and reaches those underserved communities. So we encourage everyone to register and get a vaccine. And you can go online at myvaccine.fl.gov. However, walk-ups are accepted at all of these sites. Again, Congresswoman, I'd like to thank you for having me today and for your partnership in the vaccine effort. And I look forward to your questions.
Thank you. Daniel?
Great. Our next question will go to Dr. Pino. Can you give us a rundown of who exactly is currently eligible for vaccines in Orange County and how the rules might vary at different locations? And sorry, you're muted. There you go.
I was all through before next Monday. Next Monday, we are going to be all at the same level, meaning 18 years and older. Or in this case, actually 16 years and older for Florida, and everyone who's eligible in those age groups. Prior to that, there was a little bit of confusion in the sense that the federal sites at Valencia College, which the administrator was referring to, which has done a wonderful job, was following state guidelines. And then our mayor in Orange County decided to increase the volume because we were seeing a delay in the number of appointments as they were being distributed in our community. Thankfully, we have reached very high percentage of the population vaccinated. For over 65 is about 73%. For people over 40 with one dose is about 43%. So we are in very good shape and moving forward. Today, the county gave the first, we completed 500,000 vaccinations, giving in this county 500,000. We got that today. So from Monday, beginning Monday, we all will be on the same page, anyone 16 years and older, for minors with the consent of the parent and the presence of an adult that can make health decisions.
Thank you so much. This question is for Lisa Smith. Are there any special rules, as we are all trying to encourage everyone to get vaccinated, are there any special rules or information that people need to be aware of for getting vaccinations at your locations in Orange County?
No, they can sign up on our website at www.walmart.com/COVID vaccine and come on in. There's a couple different ways that we can help the digitally enabled and the non-digitally enabled, so don't be concerned. But if you go on that website, you will be able to schedule your appointment and actually complete all of your eligibility as well as your paperwork. So all you'll have to do when you come in is actually get that vaccine administered. So there will never be a cost to you, so don't worry about that, but make sure you have your insurance card if you have it. If not, if you don't have insurance, that's okay too. But you can just come on in and we will get you taken care of. And I think there's also been some questions around eligibility and proof. None of that is required. You'll select your eligibility and you'll attest that you meet that. But as the doctor covered, with that eligibility opening up, it's going to be a lot easier and a lot less confusing for our patients. So we appreciate that greatly.
Thank you so much. Joe, is there anything you'd like to add from Winn-Dixie's perspective?
Sorry, just getting off mute. Yeah, exact same, very similarly. Go to our website. We try to make it as intuitive as possible. So you can click on there, you can see the list of sites available, and then you can schedule at whichever site is closest to you. We have a handful in Orange County, and then actually right outside your district, we have about 7 more, especially on the west and north side of the district. So I think all retailers have tried to make it as simple as possible for customers, but you just go right on the website and you'll see your eligibility, you'll see what locations are available, and then click right through to schedule.
Thank you so much. Daniel?
This is a question for the group broadly, but certainly also the Florida Department of Health. We have several constituents who've written in with concerns regarding a history of allergic reactions or other medical conditions that make them concerned about potentially getting the vaccine. Can you speak to what those folks should be doing, what the process should be like, and if they should have any concerns about that?
So yes, anyone with any health concerns of any kind, including pregnant women. We get a lot of questions with pregnant women that want to delay or go on with the vaccine. To be a decision made between the provider and the individual, and it should be an informed decision. The vaccine makers have disclosed all the elements of the constituents of the vaccines, so the allergists and doctors can look if anyone specifically has an allergic reaction to any of the elements of the vaccine. Fortunately, at least in Orange County, we haven't seen any dramatic adverse reaction or any anaphylactic shock. And we also, in all the places that we are providing vaccination, we, just in case, have a standby unit of EMS providers from the county that will transport someone if they need to do so. But again, it's a decision between the doctor and the individual. What we have seen actually is people getting very emotional, blood sugar levels going up and down for those who are diabetic and have not taken their medication, people who have waiting in line and they're a little bit dehydrated or hungry. So those are the more common reactions that we see, and in many cases are more emotional than biological in many of the cases. But although people can experience minor symptoms, and those are to a degree normal to expect in this type of vaccine. But again, it's a decision between the provider and the individuals. And for those who have allergic reactions, a severe allergic reaction, we also increase the wait time, the observation time from 15 minutes to 30 minutes so that we have more time to assess the reaction.
Great. I know you mentioned lines. I know some people have been a little reluctant because they're worried about having to wait in the line. Have there been any long lines recently at the FEMA sites or other locations? What is the wait time like at these locations? What should people expect when they go?
So I don't know how the waiting time will be at the FEMA site right now. I believe it's less than 30 minutes. Our site is also less than 30 minutes. Now there are times, in our case, because of the drive-through, it's a lot easier for the individuals in temperature control environment, and they can have their own water. We have potty parties at the beginning of the lines, at the end of the line. So we have taken some precautions. Now, what we have seen is this is kind of socially interesting. With the changing of the age of who's coming to get vaccinated, it also changed the behaviors and how they want to be vaccinated, what time more people show up. It's quite interesting. For example, when we were doing the seniors, most seniors, we got a lot of flocks around 11 o'clock to 2 o'clock. Right now that we are doing elements of the community that are most likely employed and younger, we are seeing a lot of appointments after work. So we have extended the hours. We are open until 9 o'clock in our case. The FEMA site is open until 7. And again, we haven't seen major adverse reaction, but we have advised people to take food with them, to take water, although we have water, we can provide it, but also to take your medication, your normal medication on that day, because you don't know what could have happened that you may have to do. This type of site that we operate, any little glitch, that's a domino effect that could increase the rate.
Great. And Administrator Scheck, would you like to speak to the FEMA site?
Sure. As Dr. Pino said, our sites are open. The main site at the Valencia West campus is open from 7 a.m. to 7 p.m. I know today it was taking about an hour for people to get through, but I encourage people to register. Although walk-ups are accepted, if they register, they can go through what's called a fast pass. Being from Orange County, I think many people know what the fast pass is like, and it will get them through during a little bit quicker because they are registered. As Dr. Pino said, we have water there for anybody who needs water, cold water. And when you talk about allergic reactions, we do have paramedics at the site and also EpiPens.
Great. Can you also speak a little bit to the ID requirements at your site? We did have a constituent write into the chat on the video saying they had heard of a undocumented worker who was turned away because they couldn't present a local ID card. Can you speak to what the requirements are?
Correct, and that's not the case. You know, if they do not have ID, it is not required. And we definitely have signs posted at every site, every one of our sites, to say that there will not be any issues if you are undocumented.
Great. And this is a question for our pharmacy representatives. What do we need, or what do constituents need at your locations to show in terms of documentation, or make sure that they have everything that they need when they show up?
I can start. There is no proof of eligibility required. So just as the administrator said, you do not need an ID. It's okay if you do not have one. And you do not need to prove any pre-existing conditions. Once again, as that eligibility continues to open up, that'll make it a bit simpler, but there's no need to prove that. You will attest to your eligibility, and that is all that's required. We just ask that if you have an insurance card, you bring it with you, but there will never be a charge to you. So that's all that's required at our site.
Great. And Joe, is that the case for you as well?
Very similar. We actually have our customers attest twice while making the appointment online. So when you get into stores, there's a lot of constituents that are now eligible, but should you find yourself in that 18 to 40 range and not in one of the jobs that are eligible currently, you would then have to have your condition verified by your doctor in advance of showing up. That is one issue that I know retailers have had when customers aren't showing up to the store with that form already filled out by their doctor. So if you don't fall into one of the now many buckets that are eligible, you'd still have to get that form filled out prior to coming into the store. But otherwise, you come in, you show your ID, they'll already have your appointment. You've already done the paperwork online prior. So very simple process.
Great. We have a question here from one of the constituents in our chat. They want to know, how long do the vaccines last? And another one asks, are we going to need to get additional shots in the same way that you need an annual flu shot?
So the answer to that is perhaps we don't know, and time will tell. So what I'm trying to say is this infection, these are new vaccines. So time will tell us how long these titers are going to last to a level that will protect us. There is a possibility that an annual booster may be needed. And also, we think that we are going to control the pandemic with this vaccination effort to some levels, but for a while, the virus will continue to be in our community. It will be manageable. We will be able to do better control, infection control, and better practices of public health by tracking and isolating as the numbers are smaller. It will give us the ability to be more efficient. But the reality is that we don't know how long this immunity is going to last, and if this is going to be an annual booster that we will need. And that's why I encourage everyone to get vaccinated. Right now it's free, right now it's everywhere. This will change in the future when we bring it to control. It will be a little more difficult to get vaccinated, or fewer places offering. This effort that we have right now is not going to be permanent.
Great. Another question from our chat. Maura wants to know, will the FEMA sites be administering the vaccine to people under the age of 18?
We follow the governor's executive order on eligibility. So as of right now, it's 40 and over. And then effective on April 5th, it'll be 16 and over for Pfizer, which is what is being administered at all the federally supported community vaccination centers.
Great. Another question for our group generally. We all have heard from people in our extended social circles or our families who are a little bit skeptical about getting the vaccine. What do you say to these folks to convince them to get the vaccine? What are the best messages for talking to people who are in your social circle about this issue?
I think that if anything can help to convince anyone is to look at the data on 75 years and older hospitalization and death, and how it just went straight down when we started vaccinating. It's just an incredible to look at this data and see how quick this vaccine has been able to control the pandemic in the groups that has been vaccinated. And also another important element is free. So it is free for everyone. It may not be in the future. Another important element is everywhere. So it will be very easy to get. And second element, you have to protect others. And our ability to express the disease asymptomatically, even without us knowing, is a concern that we should all take into consideration when making that type of decision. This is not just about us, it's also about everyone that's around us.
Yeah, I would agree. I think the data on severe disease and death is so important to tell everyone. Even though vaccines are usually not 100% effective, their effectiveness at preventing severe disease and death has been remarkable. And I think, as Dr. Pino said, you have to help the people. I'm a mother of young children who aren't eligible to be vaccinated. And so I'm not just getting vaccinated for myself, I'm getting vaccinated for the people who aren't eligible, or family members and friends who may not be able to mount the same immune response. So I think it's about helping ourselves and helping our communities.
Great. Another question from one of our participants here. They'd like to know, how can a work environment be made safe or safer for COVID-19? What is the recommendation in terms of air conditioning and airflow, distance between workstations, mask use, that kind of thing?
Well, we don't have a specific regulations right now for the work environment besides what is well known for the entire community with regards to CDC recommendations. But I'm pretty sure this pandemic is always going to generate all sort of regulations for work environment, especially for highly congregated environments. Like, we have a lot of issues with packing plants and farms, hydroponic farms, and these type of closed environments. Also, is interesting enough, for example, with the parks. We in Central Florida have these business of major amusement parks, attractions in the county. And we have not seen a large number of infections in those parks, even though they are open at 50%. So it's an indication that closed environment versus open environment is an important element to take into consideration when making those regulations. But I'm pretty sure airflow is going to be one that probably OSHA is going to look very tightly at it after we are over this.
Here's another question from a constituent. Are there any circumstances under which anybody should or could get multiples of the vaccines?
Again, the question?
If somebody had one of the vaccines, for example, the Johnson & Johnson shot, could they then get one of the other vaccines on top of that?
Okay, we have 3 vaccines in the United States. Johnson & Johnson is one dose, so that one will not be any need to do a second. On the other 2, initially the thought was that you shouldn't. And the thinking right now is you should not. If you can, you should try to avoid mixing up the vaccines. Both vaccines are very similar into what elements they use to generate immunity, but the CDC is recommending to adhere the same vaccine that you received this one. Now, in circumstances, it can be giving a different vaccine for the second dose, and that will be fine. And it also had happened by mistake, and the individual has nothing to do. There is no need for any other intervention. There is no need for additional medication or anything. It will act, it will get immunity, but we should try to keep it on the same series if we can, when we can.
Great. Is there anything else anybody would like to add on that topic? All right. In that case, we have a constituent, Jackie. They would like to know, should we be frightened of the new variants, and what is the current status for the current vaccines that are out there at preventing them?
So I think that, I don't know if the word is there, but we should be concerned. And we should be observant. We should be careful, and we should try to vaccinate as many people as possible, as fast as possible, so that we can get ahead of these variants. Most variants, the vaccine have shown to be effective. I believe in the South African variants, which we don't have in Orange County that we know yet. There are some level of resistance to the vaccines. But we have about 80 plus cases that has been confirmed to have been of the variant. Most of them are the England, UK variant. And we have, I believe, one from the Brazil variant and one from the California variant. And all those respond well to that.
Great. Here's a question for Administrator Scheck. What is the current situation at the FEMA sites for walk-ups? What do people need to bring with them, if anything? And is there assistance available for people with disabilities or other needs?
Good question. Yes, people can do walk-ups, but again, it might be a little bit longer wait if you haven't registered ahead of time. We do have wheelchairs, and we will have an escort the entire time if someone is coming without their caretaker or a family member or friend, and we will make sure that we get the person through to the very end and to however they got there in transportation to that site. So we do have all of that available and taking care of people.
Great. I would like to also remind everybody who is on the call, our office is available for constituent concerns. So if you do have a personal issue or a question about a federal service, go to demings.house.gov and get in touch with our office. We may be able to help you. This is another question from a constituent. Maggie wants to know, she has heard from some of her coworkers that they're concerned about taking the vaccine because the new mRNA process might overwrite their natural immunities. Can you speak to that? How do these new vaccines work? Are they safe? Are they tested? And what should people expect when they're getting them?
So Pfizer and Moderna use the technology, which is, let me see how to explain it. There is no virus in those two vaccines. There are proteins from the corona, from the crown of the virus, not the virus itself. And because when that messenger goes into your system, it tells your system, produce immunity for this protein, not for the virus itself, just for the protein. And when the virus comes in, because it has those proteins, it will identify and generate that immunity. Johnson & Johnson is a little bit different. Johnson & Johnson use a virus. They generically modify the virus so that the virus cannot reproduce inside your body, but it can generate immunity. It's another type of virus. It's not a coronavirus. It's a adenovirus. And so those are the elements. It doesn't override your immunity. Those are a little bit of myth. And they are all generated in the cyberspace, but there is no truth to it. These vaccines are very effective and very safe. They went through a rigorous process. And just for people general understanding, when we say phase 3, which the vaccines go, so vaccines are tested in labs, they are tested in animals, and then they are tested in humans. That's the phase 3. So we have to go through a rigorous process to be able to assess safety and effectiveness. Now, what happened with the vaccine is that unfortunately the whole process got politicized from the beginning, and that always generates insecurities in the general population, which get confused with the political environment, getting to this type of expertises. But the reality is the vaccines are very effective. They have demonstrated, the data is proving that, and the side effects are minimum compared to the benefits.
Great. Congresswoman Demings.
Thank you so much, Daniel. And you know, our primary responsibility, and you all are doing such an amazing job in terms of getting as many people as possible vaccinated from all different communities. But we do know that there are still some vulnerable communities out there who may not be able to get to your particular locations. Could you all discuss a little bit your efforts to actually take the vaccinations, if you will, into some of these more vulnerable communities? If you're working with or through faith-based organizations, for example, those trusted venues and voices, what are your efforts to, or have you engaged in any efforts to actually get the vaccinations into the communities that need them the most?
So I guess I will go first because that's my job. So we have taken many approaches. Let me describe what FEMA is doing first, and then we'll describe what we're doing. So with the help of FEMA, they are canvassing some communities. They are using what is called the Social Vulnerability Index. It's a disease measure that takes in consideration many elements in the community to basically say this community has scaled this number of points. This is a poor community with poor resources, lack of transportation, health issues. So we are directing resources there. So our FEMA with the state canvassing and our fire departments, Orange and Orlando, are going around the neighborhoods, knocking at doors for places with high social vulnerability index the day before they are going to be present there, so that people in advance know that vaccines are going to be there next day. And people can be even get registered if they want to go to any of the other sites. Another thing that we have done is we basically all the congregating senior housing in our county. We were to congregate senior housing, did the vaccinations there so the senior didn't have to leave those facilities. We also going home by home, doing people who are homebound or isolated at home based on the listing that we have for natural disaster. And now we are able to do the data by census tract. We know how many people have been vaccinated in each census tract. And now the next step is go specifically to that block and just loudly say to the people in the block, hey guys, we are here, who wants the vaccine? But for that one, we are waiting to get Johnson & Johnson, because that's a strategy that works with one dose vaccine. Because those are places that you may not see the same people again. So you get there, you your vaccination, you leave, you don't have to come back. Those are some of the different strategies that we are using in collaboration with FEMA, our county, the fire department, and the state of Florida.
Thank you so much, Dr. Administrator Check. Would you like to add?
Sure. It's as Dr. Pino said, it's been a great partnership, and ensuring that we are getting out into those communities and getting those people vaccinated. The satellite sites that he spoke about, they move too. They go to different locations every so many days, administering first shots and then going back for the second dosages 3 weeks later, or if able to do Johnson & Johnson. I know that there's 2 sites that will be open tomorrow, new sites. That's in Barnett Park, and then also at the Mary Jane Arrington Aquatic Center. And again, that's all in partnership with the state Department of Health and Division of Emergency Management in looking to the best locations of where to place these sites.
Thank you so much. Mr. Caldwell?
Thank you, Congresswoman. Yeah, we've had sites across the state. We obviously have our 158, 160 pharmacies inside the state, but we've been doing pop-up clinics in the more rural areas with less access to vaccine. And just like Dr. Pino said, in those high SVI areas. So we actually have a plan starting next month to have more pop-up clinics around the area, especially looking at areas like Orange County with a higher population, where we don't have as many pharmacies to the population that we do in, let's say, South Florida. So more to come on that, and we'll be sure to communicate that with your office.
Thank you so much. And Ms. Smith?
Yeah, SVI, social vulnerability, and demographics are at the heart of our site selection. And we're proud that 4,000 of our 5,000 pharmacies exist already in medically underserved areas. But we also know that we have to partner with the communities where they are. Faith-based organizations, we've done pop-up clinics at senior housing authorities, the urban leagues, immigrant housing. We know that we have to take this vaccine where people are, but also partner with those community partners, such as pastors who are trusted to spread that message. And so that has been really, really key to our response. And we plan to continue to do that, as well as making sure we have all our information available in multiple language, interpreter services available as well.
Thank you so very much. I know we have a few more minutes left. The information has just been so invaluable to our participants, those who are tuned in with us today. And Daniel, I'm going to turn it back over to you to get some more of our constituents' questions answered.
Sounds good. Here is one following up on that last issue. This is a question from Pastor Charles Williams Jr. He says there was a push earlier on in the pandemic to partner with local churches, particularly in order to get the vaccine out into communities. But now that the age requirement has been lowered, now that the access is broader, will those efforts continue? Will there be more of those efforts to partner with local churches and other partners to get the vaccine into the communities? And you are muted.
That's always the case. But better muted than noises in the system. So yes, we will continue this morning. We were doing a church on Oak Ridge, a Latino faith-based church, and it was very successful. It was a drive-through. So the process is more about the ability of vaccines, and as much as we are getting, we are distributing, and based on the needs and where these churches are located. And also with churches, you have to take into consideration that you want to serve all denominations, and you want to make it available to anyone. So with that, we are moving into first the larger church, which we need to generate volume, but we will reach any church that wants to do business with us as progress in the distribution increase. Because again, part of the issues that on main side is about 3,000 right now, close to 4,000. Lima is also doing 4,000 a day. So those are significant volumes of vaccines. So it's more about having the vaccine than the will to distribute the vaccine.
Great. Here's another question from one of our constituents. If they are somebody who has had previous severe allergic reactions to other vaccines, is there a particular vaccine which is better on that front, or one that they should try to prioritize?
Well, not all the allergies were equally created. So it could be that someone is allergic to a component in Moderna and not in Pfizer. So again, the vaccines have released all the components of the product so that a person with severe allergies, like you have mentioned, I will advise that they look at their allergist to make that decision, specifically looking at the components. Another precaution, and we always have it, these individuals should have the EpiPen on them when they go for the vaccine in case that the site doesn't have it. Although in Florida, each site that is offering vaccination must have an EpiPen, but if they use EpiPen, they should have it on them. And again, their allergists should be making that decision.
I did hear from a constituent the other day who she had heard different things, conflicting advice from a couple of her doctors. This is a woman who had previously had cancer, and her cancer doctor and her primary care doctor gave her different advice on the vaccines. I know you don't know the details of this individual's particular health situation, but do you have general advice on what people who are in that kind of situation might do next?
Well, yes, that has happened a lot, actually. Having conflicting information, because you have your primary care and then you have your cardiologist, or you have your cancer doctor, and one say no and the other one say yes, and the other one say wait 14 days and the other one say wait 90 days. So stick to one doctor and follow that doctor's advice. I will say, go for the doctor that you are dealing with the biggest health risk that you may have. So if you are dealing with cancer, just a significant health risk, talk to your oncologist and ask your oncologist what they think. The idea in general is when you get this conflicting information from your doctor, always follow one, stick to the guidance, and go with the specialist that has the highest level to the type of risk that you are facing.
Here's a question from our chat for our pharmacist who's on the call. Can you speak to the efficacy of homeopathic treatments generally, but also in this particular case?
Is the question specifically homeopathic for COVID treatments or
It is.
vaccine side effects for COVID? So homeopathic treatments are not evaluated by the FDA. So there is not safety and efficacy around those. So I would recommend, go with trusted sources, your personal doctor, look at different things that are evaluated, the CDC guidance around treatments, and anything that has received an FDA authorization or approval during the pandemic. But if you have a specific question about a homeopathic, our pharmacists are there to answer those questions, or your personal healthcare provider.
Great. Next up, this is another question regarding faith-based organizations, but more in relation to COVID-19 and the pandemic generally, as opposed to the vaccine. What are the current rules for social distancing? How do we expect that to change in the near future? When can people get back to church?
Well, I mean, people have been in church. Not all churches have reacted the same way to the pandemic. At some point during the pandemic, not right now, that's not the case right now, because an older segment of the population has been vaccinated. But it's segment of the population at some point during the pandemic, we always saw an increase of cases by Wednesday, and they were related to church, to church going activity. More than anything, what we thought was churches that have more than one service, and we were concerned about that exchange between congregations, and having the proper cleaning procedures in place when changing congregations. And again, if we are here to receive guidelines, what we are trying to do is to diminish the risk of getting the virus. And by cleaning, by having social distancing, and by having virtual services, we have learned that the technology is here and that we can do more through this type of environment where we can be all located in different places. But people are going back to church, and pretty soon we will be a full church on Sundays, like we all do.
Great. Here's another question from one of our constituents. For people who are getting their second shot, but really either shot, are there things that they should do beforehand or afterwards in order to reduce the side effects that are expected?
So the issue is that not everyone gets a side effect. So you don't want to take unnecessary medication. Again, for these, you should follow your doctor's advice. Now, second dose for the Moderna and Pfizer, many people experience mild symptoms, fever, discomfort, aches, pain, and fatigue. It lasts only 24 hours. I had it myself. Not a big deal. And in those cases, you take what you normally take. It happens with many vaccines. One that gives a lot of secondary side effects is, for example, the shingles vaccine. It's one that we all are getting. It's getting a lot better, but it has a lot of secondary side effects. So it's not exclusive to the COVID, and that's important. When you get this type of treatments or interventions, it's likely that you will experience some type of secondary effect. And not at all, it's not that bad to have secondary effects when you take the second dose, because it really means it really worked for you. You really got the first dose to give you enough immunity that your body is recognizing the second one right away. So It's a mixed bag.
And Mr. Caldwell, Ms. Smith, do you have anything you'd like to add on that?
No, I would just add the CDC is not currently recommending any kind of pre-treatment. But as Dr. Pino said, to manage any side effects afterwards, I think those folks who are having fever, I think Dr. Fauci mentioned it, hydration, all of the things you would normally do to manage those type of side effects. And the practitioner that gives you the vaccine, especially that second dose, can help advise you on what might be right for you.
Great. All right, we'll take one more question from our viewers. The question here is, how long after testing positive should somebody wait before they get vaccinated?
So for our sites, we want to make sure that you are out of quarantine and not currently contagious to come to our sites for vaccination. So make sure you stay at home, take care of yourself when you're in that quarantine requirement. And then you can get the vaccine anytime after that, depending on the treatment you received, such as the few people who may have received monoclonal antibody treatment. There is a wait period for that. And I think the CDC has advised that you can wait up till 90 days, but for normal patients who didn't receive any monoclonal antibody treatment, we just want to make sure, especially in our stores, to keep everybody safe, that you stay quarantined when you need to be quarantined, and then we can take care of you after that.
The general rule is 14 days, as Lisa just mentioned, getting out of the quarantine or the isolation if you have that. But 14 days is what is advised. Now, also, not only having had the COVID-19, but also if you have any vaccines in those 14 days, you should wait 14 days after any vaccination to get the second. And basically, why are we doing this? You don't want to overload your immune system with responses and overstimulate it. So you give it a place, you give it a break, and then you shoot it.
Great. Thank you again to our panelists. Before we turn it back to Congresswoman Demings, just a reminder, the Congresswoman's office is here to serve you and your needs. You can always reach out to us through our website, demings.house.gov, G-O-V. And with that, I will turn it over to Congresswoman Demings for some final remarks.
Daniel, thank you so very much. And first of all, I know you all join me in thanking Dr. Anthony Fauci, who took the time to answer the questions during the first session of this wonderful presentation. I also want to thank Carmen Torres and Faye Norris for their participation in the first session. And Dr. Pino, I hope you know how much I and this community appreciate you and the amazing work that you are doing to make sure that we all stay healthy. To our amazing panelists, Administrator Check, it's great seeing you again. Thanks for being with us today. To Lisa Smith and Joe Caldwell, thank you for also being a part of this panel and just making sure that our constituents, the people that we all serve and represent, have the information that they need to keep themselves, their families, their coworkers, and others safe. We all want to get back to normal as quickly as possible. It's been a long year, but we also know we need to do that as safely as possible. So thank you all for joining us today and answering our questions, and also to the constituents who tuned in. Thank you for taking this time to arm yourself with much needed information. I also want to take just a moment to, again, thank my staff who surely make sure that I have the information that I need and am in the right place at the right time. So everybody, thank you. The time goes so quickly. I know there are many of you who are still there and you did not have an opportunity to have your questions answered. Please do reach out to our office. We are here to answer your questions and make sure that we serve you all well. Until the next time that we are together, please take care and stay safe. Thank you all. Bye-bye.